Hi, Dr. McCarthy here, and I want to welcome you to Neuropathy Success Secret number 15. Today we're going to talk about leaky gut syndrome. And many of our neuropathy patients who are dealing with the burning, the numbness, the tingling, the unrelenting pain in their hands or in their feet, many of these patients are dealing with leaky gut syndrome. The problem is you don't even know that you have it. You haven't been properly tested or properly evaluated for it. There is a direct connect between the brain and the gut. When there's a problem in your gut, it affects the way your brain works. And in a previous video, we talked that the brain is the master control system. It is the area in your body that controls and coordinates the function of all of your cells, including the nerves in your hands and in your feet. So if there's a problem in your gut, it can affect your brain and it can directly affect your neuropathy. If you are still suffering, you've got to get evaluated for leaky gut syndrome. The issue with this is that your intestines are supposed to allow little tiny particles to get through, vitamins and minerals and nutrients, and when this is properly functioning, you are healthy. When you've got increased in your intestinal permeability, those little tiny holes become large holes, and it allows large molecules to get in, which activates your immune system. Your immune system can be playing an enormous role in your neuropathy symptoms. So you've got to get evaluated for this. The number one reason that we see that people develop leaky gut syndrome is food sensitivities. And there's lots of different foods that you need to get tested for. We know some of the big ones: gluten, casein, soy. And if you've got a sensitivity to these foods and you keep eating them, you keep perpetuating the leaky gut. You keep throwing fire onto the already brewing fire in your immune system. You keep making this worse. Another issue is we see subclinical infections or even a parasite infection. Parasite infections are very common. And again, if you haven't been properly evaluated, you don't know if you've got a parasite. See, there is no need for you to keep suffering. You've got to get the proper evaluations done. And if your evaluation was a nerve conduction study and then here's some pills for you and you're still suffering, that's not good enough. Look, if the pills are working for you, you wouldn't be watching this video right now. If you're still suffering, you've got to get this done. We've got to find out what's activating your immune system that's making your neuropathy worse. If you are still suffering, you need to call my office now. Thank you.